I thought in the interest of people knowing, this is another one of those things that is kind of linked to the SUDEP thing, in the sense that, physicians used to shy away from telling their patients about sudden unexplained death in epilepsy. Okay, and I was thinking, how do we tastefully talk about this, or how do we address this particular issue, or whether should we?
Well, I think, and I've worked with several different programs with trying to educate. I'm not going to give it up yet, what we're going to talk about, but trying to educate on factors of this. And I feel that miseducation is one of the ways to continue things that are happening in a negative manner. If we continue to keep all stuff taboo, we don't want to talk about epilepsy, we want to talk about SUDEP, then how do we move forward to really finding a way to help our communities not suffer from these things? So, it is touchy, but, when did we decide? We have no bars. We just talk about what we want. So let's just hit it out of the box.
I can just click their mouse and we're gone, right?
Close out. But I think for those that are a type of people that will look and think outside of the box, they will feel like this. And it may be somebody that has.
This might be important.
Yeah, or think about it. This is devoted to women's health. This is devoted to pediatric. So there are so many different pieces that we need to speak this up.
There's an innocent child that may very well be at risk. With
And
this.
even mother and child. And who knows? With all of the different developments on this, we don't know. We could all be being affected. So,
what's been found as a causal link between HPV 16, which is a sexually transmitted this virus.
The Human Papilloma Virus.
Okay, and there's been a link that has been found between that and focal cortical dysplasia. Okay, now
are people, just so people understand that, but HPV is one of the causes for cervical cancer too.
it's one of the main causes for cervical cancer. So they're saying that not only does it cause cervical cancer, okay, but also we're finding that people who have this, their children sometimes, there's a greater incidence of their children having this focal cortical dysplasia, okay, which is not good.
Right.
And the focal cortical dysplasia can cause a person to have seizures. Okay, so that's and is a cause of childhood epilepsy. So there's this link here, okay, and it's important because if in fact the person has this, if the mother has this, okay, certainly there should be some counseling and there should be some thought taken as to whether or not
Pre-planning.
Yeah,
Pre-planning pregnancy.
And so we don't know where this is going. We just know that there's this causal factor.
Right.
Okay.
Right.
Again, this is one of those flags. Okay, that says, maybe we need to investigate this a lot further. This is something else that we need to look into.
Gupta told me cannabis was good for that too.
I'm just kidding.
I'm just kidding. But, and here is another thing too. On a woman perspective, we really get the short end of the stick. Here it is, and I don't.
Okay.
I meant that in a whole different way, okay? But thinking about that, having that as an issue, and that's why it really is important to plan. And this doesn't have a real focal point on it just being women with epilepsy, but preparing for those things. So make sure that even if it's something that you're dealing with, that you go and find, like you said, that counseling, or maybe there's some other options to preventable reasons or ways to, to make sure you have a healthy baby. So
that maybe we can prevent the development of epilepsy or somehow modify it. You know, and that's why it might be important for early screening and also for the HPV vaccination. See, the thing of it is that women can get vaccinated against this particular virus. Now, whether that has any effect upon, you know, them passing this on to the epilepsy on to their children or not, I don't know. They don't know. Okay, but certainly those particular things are going to be researched. And, you know, if in fact this vaccination turns out to be positive, you know, in prevention of epilepsy, wow.
Well, and then, you know, we were talking about that too with that HPV. I think that from what I recall about a lot of the information, that it was being given to like teenage girls, because that was a better time to, I guess, with the vaccination helping, I guess maybe before any type of sexual activity or whatever the case. But these are things that, you know, we talked about even with the birth control. People want to shy away from things, but these are the things that continue to really put us at risk.
Yeah.
You know, so being able to know, I mean, and it also is about making sure you're having the right communication. I think that we can't put it on a subject or a topic that we can't do it. You have to make sure that you're discussing these things to give that information to make better choices. So if we continue to keep it on the hush, how do we move forward and develop better practices?
And see, the whole thing of it is that what they're recommending now with this, this particular vaccination is not only do females get it, but also males get it.
Yeah.
Okay.
Yeah.
And you know, if the male population would get this, guess what?
Well,
The
and
female
then,
population wouldn't get it.
well, that too, and that's what I was just thinking about in some of my other work, that just because you can't, it is something that's transmittable, you know, whether it's something that affects women with the cervical cancer, but by far, I think that there are still effects with men as well. So we just have to make sure we keep each other safe, and by keeping each other safe, we have to have the right information. So shoot your kids up with the HPV vaccination. And if you don't, I mean, and just again, being able to have those open conversations with your children about that. That's very important.
I think so. And for people to make informed decisions.
So if they need help with counseling or talking to their, I mean, with putting this information, who do you think they should call? You think they should call us?
I don't know. I think what they probably need to do is they need to talk to their the physician who would be in charge of the family planning and things such as that.
I was trying to put our number and website out there.
I think they should call that.
Okay, well, still call us if you ever have any other questions. www.epilepsy-ohio.org, 1-877-804-2241. Don't call us about HPV, but anything else that has to do with epilepsy.
And even then, we'll be happy to share the information that we have with you, so that you can take it to your
Physician.
To the person who's helping, your physician that's helping you with your family planning.
Right.
And talk to them about it and see what they say.
Right.
Okay?